Good afternoon, everyone. Thank you for joining us today for our Lunch and Learn on STI awareness. I am Donna Miller, and we will get started in just about a minute or two. We like to give a few minutes for the audience to build. So, thank you for joining us. And if you are just joining, it'd be great if you could let us know you're here. And we will get started in about 2 minutes. We're about to start our lunch and learn in about 2 minutes. So please give us a couple of minutes for the audience to build. Thank you everyone for joining us. We're going to get started in about 1 minute. We wanted to give the audience a chance to build. So if you're here with us today, please just say hello in the chat so that we know you're here. And for those of you who are on, thank you so much for joining. This will be recorded, and you'll be able to see this broadcast again on our Facebook page at Cook County Commissioner Donna Miller. I'll get started in about 30 seconds. Thank you. Well, good afternoon, everyone. Thank you for joining us today. I am Donna Miller, Cook County Commissioner of the 6th District, and I represent the 36 municipalities in South and Southwest suburban Cook County. And today, I want to thank you all for joining us today for our Lunch and Learn series. And we are discussing the importance of awareness on sexually transmitted infections. So before I introduce our speakers today, I wanted to shed a light on how much is going on this month, and we're really honoring so many things. We're honoring Black Maternal Health Week, which is actually this week and ends on Friday, and we've had a whole series of information focused on that topic. It's also National Minority Health Month, and we will focus on that a little bit as we touch on this subject as it relates to STIs. And at our board meeting on April 7th, we approved a resolution that I introduced for April for Minority Health Month and for the week of April 11th through 17th and Black Maternal Health Week at Cook County. So the Black community, like other communities of color, are more likely to experience the socioeconomic disparities such as exclusion from health, education, social, and educational resources. And that is something we aim to work on as the board of Cook County. The disparities contribute to worse health outcomes, which we are keenly aware of, especially as we look at what happened during COVID and will continue to happen. But what has always been true is that Black women in the United States experience unacceptably poor maternal health outcomes, including disproportionate high rates of death related to pregnancy or childbirth, and 3 or 4 times more likely to experience pregnancy related death more than white women. And unfortunately, here in Illinois, this maternal has been, these death statistics are even higher than the national average. And we really have not come to grips with why that is, that in Black women in Illinois are 6 times as likely to die of pregnancy related conditions than white women. So National Health Minority Month is a time that we can really double down and focus on these efforts to improve our health delivery systems by listening to our community concerns and work to build the trust that we have lost over generations of poor treatment. As we bring awareness to these important health matters, I'd be remiss if I didn't acknowledge that, again, today, this month, April, is STI Awareness Month, which is why I wanted to have this important discussion today on this topic. So we'd like to share, and we want you to pay attention and share this information, probably with those who might not be listening right now, the teens, the teenagers. So I'd like to introduce our speakers who we have with us today and really appreciate them for joining us and sharing their expertise. Our speakers can just come onto the screen. We have Tony Valencia Johnson, who is from Cook County Department of Public Health, and she is actually in charge of STI department, and she will get into discussing that just a bit. We also have Dr. Rachel Rubin from our Cook County Department of Public Health, who is one of the co-directors and has been super busy, not just because of COVID, but because of everything else that's going on in Cook County as well. We have Dr. Latasha Wright, who is a clinical social worker and also has expertise in the school system. And then we also have, I'm sorry, I don't have the other nurse's name, from Thornton Fractional High School, who's also intimately involved with the students, which is the group that we're really trying to focus on. So ladies, thank you so much for joining us. I'm glad we have our all-woman crew here, but it's also equally important to say that your expertise is so needed in these areas. So I'd like to just go through and have each one of you introduce yourself briefly, tell a little bit about what you do in your work in your department. And I'm sorry, Kristi Smith, I didn't have your name right in front of me. And so why don't we start with you, Kristi, and then we'll go to Dr. Wright.
Hi, yes, I'm Kristi Smith. I am a health assistant for the Thornton Fractional District 215. I right now work in the alternative school. I take care of the day-to-day things that the students need, any injuries, any minor illnesses. I also take care of the data here and all of the logging all of their information in. I've been here for about 4.5 years now.
My name is Dr. Latasha Wright, and I am a licensed clinical therapist. I was previously employed with Bloom Township District 206, and I served as the district mental health counselor. And before that, I was with Ford Heights, right down the street, as the district professional school counselor. And in all of my roles, I definitely work with adolescents who come to me at some point in time with an STI question. So this population is definitely in need of as much information as we can possibly give them.
Hi, I'm Toby Valencia Johnson. I am the STI HIV program manager for Cook County Department of Public Health. I manage our STI HIV team that includes STI surveillance, the STI field team, HIV surveillance, and the HIV field team. I also chip in. I will investigate cases or assist any of my team if they need help. I've been in the field for 22 years, and I've been at Cook County for 18 years.
And I'm Dr. Rachel Rubin, and I'm a senior medical officer and a co-lead of the Cook County Department of Public Health. And I'm so glad that we're doing this today. This is tremendous. So our health department, as Toby mentioned, we are required and responsible for doing surveillance and intervention for STIs and HIV throughout suburban Cook County, for those minus a few, 3 or 4 municipalities that are not in our jurisdiction, but generally the majority of Cook County. And, we try to intervene and get people into treatment, and also not just sort of crunch the numbers in terms of keeping track of how many cases there are, but the point of that is to get people into treatment and to do contact tracing, especially for syphilis, so that it doesn't spread. And the hope is we also do a lot of education with respect to preventing sexually transmitted infections in the first place.
Thank you all so much. And I appreciate, again, your time and your valuable opinion. So I would just we're going to make this like a panel discussion, so that if each one of you could kind of just talk, first of all, about the importance of what you do, specifically related to STIs. And I'm going to bundle this question kind of together, because I know over time, the word STI has changed from STI to STD or from STD to STI. So if you could explain the difference, if there is a difference. And we'll start with you, Dr. Rubin, and just to explain how this affects the whole county STIs and why we should be talking about that. And so I'll just let each one of you go after Dr. Rubin. And Toby, maybe you could go next after Dr. Rubin.
So sure. I mean, first of all, I think that going from sexually transmitted diseases to sexually transmitted infections, the terms are sort of used interchangeably, basically. But the shift has been to sexually transmitted infections as a way of emphasizing, indeed, that these are infectious, contagious diseases that can be spread from person to person that cause diseases. So you can be infected with syphilis, for example, and it can create any number of disease processes in the body depending on where it's infected. You can get it in the brain and get something called neurosyphilis. For example, there's congenital syphilis, which is when the mother transmits this while she's pregnant to the unborn fetus. And then when the baby is born, they have syphilis. And so these are different syndromes. So that's why we're talking about infections as a whole. And the idea is to stop the infections before they create diseases, right? And why is it so important is because we're seeing an incredible rise of sexually transmitted infections over the last decade. Right now, in suburban Cook County, we have just in 2020, we had over 10,000 cases of chlamydia alone diagnosed, and over 4,000 cases of gonorrhea. And this also, these chlamydia and gonorrhea disproportionately affect our communities of color, especially our African-American communities. And that's not because of any specific behaviors. We are not talking about individual behavior change. What we're talking about, these are the communities that have the lowest access to medical care. There may be fear with the, of accessing and embarrassment and fear of accessing medical facilities, thinking that there would be confidentiality issues. And so people are afraid to do that. And there's understandable historical distrust of healthcare systems. And so people may not access that. And people can't afford their basic needs, so they're not going to necessarily go to the doctor because they need to have money to go eat as opposed to money to go to the doctor. Because frequently the initial symptoms of sexually transmitted infection are either very mild, they can even be asymptomatic, or if they're so mild, they're just more of an irritation until they become a big problem. And that's when we end up seeing them. So why don't I have Toby fill in some of my gaps?
Thank you, Dr. Rubin. Dr. Rubin touched on something I was going to bring up, and that was the symptoms. A lot of times with women, at times there are no symptoms for chlamydia and gonorrhea. They're not aware that they have it. But in the meantime, the infection is spreading through the reproductive system and could eventually cause pelvic inflammatory disease. Also, with syphilis, the symptoms appear like nothing, like there's a sore, the sore is painless. So a patient may not be aware that that's actually a sign of syphilis. The sore goes away in about 3 weeks. Then there's a rash on the hands that also goes away. So the person is walking around with syphilis and they're not even aware of it. Another thing is these infections can be passed on to babies. So it's very important, especially I think Ms. Miller said that this is Women's Health Month for April. It's very important for women to get checked out annually, but also when they're pregnant, to make sure that there's no infection that will impact the baby, whether it's chlamydia, gonorrhea, and particularly syphilis is quite serious. So that's my reason that I feel that not only is it important for us to make sure our patients are treated and to make sure we stop the spread, we also have to present prevent the infections. We want to present information to the community, to the public, so that they are aware of their risk and they are aware of how they can keep from getting the infection in the first place.
Thank you. So Dr. Wright and Kristi, both of you being in the school system, what do you think about the importance of talking about this topic? And do people, as Dr. Rubin has just outlined the difference between STIs and STDs, it's kind of illuminating for young people to understand that because it can affect the rest of their life. So Dr. Wright, do you want to chime in?
So it's interesting that as adults, we know the statistics, we know the terminology, we know the causes, the effects, how to prevent these things. But what we have to remember is that when we are dealing with adolescents, their brain is still developing. So there are a lot of things that they have yet to even be introduced to. So in my role, it's twofold. One, I'm passionate about education, and two, I'm very passionate about mental health. And anytime a student comes to me, and this has happened more often than a lot of people may actually want to realize, they come into my office and they're just completely upset. Dr. Wright, oh my God, I can't believe, and the young men, believe it or not, are actually the most dramatic. I got burned by this girl. And I'm like, oh, okay, let's take a minute, calm down, let's process. And so when I began having those conversations with them, in their minds, they really don't think that, well, I just did oral or we had anal sex. So they really don't understand that an STI can be transmitted through a number of ways. And then once that happens, then that's when I start to see the mental effect of the depression. They go into a very, very deep, dark place because in their minds, this can never be cured. They will have this forever. Life is just absolutely over. So then that's when I come into a different role and really have that education conversation with them, that if we understand what we're dealing with, if you understand what an STI is, how to contract it, how to prevent it from happening, then we can hopefully avoid those mental health issues that we are seeing on a rise. Depression, anxiety are the leading two mental health disorders right now. But a lot of students really just need to be taught. And the other role that I would play in this is educating our parents, because a lot of parents themselves don't know the terminology, don't understand how things are transmitted. So in the district that I was at before, we would actually have Parent Academy. And this is a topic that was talked about so that parents understand that, what you may have done in high school or the terms that you may have used, it's a new day. And these kids are very creative with how they initiate sex and what they are calling sex these days. And it's even very interesting what they're calling STIs. So that's why I think this is so important, to educate them on the proper terminology so that they understand what happens when you choose to have sex.
Yes, and to bounce off of you, my role here is to educate the students, and there are so many students who have no knowledge of STIs. A lot of them don't have access to healthcare, or they don't have a relationship with their parents. So here I'd like to educate the students and get them comfortable enough to talk to me, where they can practice to have a conversation with their parents. Because that's the biggest issue here that I'm seeing. A lot of them don't have that comfortable relationship with their parents where they feel that they can even tell their parents that they're having sex at this moment. So I like to go into the health classes and I educate the students. And unbelievably, a lot of the students, they don't even know what the STDs look like. They do not know about the symptoms. They have absolutely no knowledge. Like you said, their parents may not have the knowledge also. So I try to educate them as much as possible.
Wow, that's really so good to hear, in that sense that you're there. First of all, for both of you are there to help with the education. And Dr. Wright, I love the idea of a parent academy, because just because you're a parent doesn't mean you're equipped with this knowledge. It doesn't come in a manual for you to check that box off. So that is really excellent. And I know we've talked a little bit about the terms, and maybe we can get into that a little bit as to the different words that are used and how they're describing sex and STIs. And when they come to see all of you, pretty much, what are some of the things you're hearing? And it's not just young people; it could be, any age people. What are some of the things you're hearing? Dr. Wright, you want to just get started on that, and then we could go to Dr. Rubin.
So when I was tasked with doing this, I decided to go straight to the source, to the young people. And needless to say, as I was writing these things down, I was very taken aback because I had never heard of a lot of these terms. So here we go. The first one that seemed to be pretty popular was smashing. That one was, I was like, okay, I actually know what that one was. DTF is one of the codes that they love to send, and that is down to now this was interesting, a henty. And I said, a henty, what is that? A henty, a lot of our young people are into anime. And so somewhere out there on the internet, they have created animal porn anime. And a lot of these students are watching it, and they are trying to manipulate what they see on TV or in real life. A lot of a schlong, which is a long penis. WAP, which was made famous by the artist Cardi B. Pushing P. And I had to think about that for a minute, and I obviously knew what the P meant, but the term pushing P was she meant it as, when a girl is pushing P, that means that the boys are actually talking about her and that it's so good, and they're sending this around via text message that, hey, if that's the girl that you want because she's pushing that good P. GNOC, get naked on camera. And that's another issue that we see a lot in the schools, is that we have a lot of direct messages going around, a lot of Snapchat, Instagram pictures and videos are sent. And then, I only sent it to you. Don't send it to anyone else. But then, of course, we know what happens in most cases. It gets sent out, and then it turns into a really bad situation. And I have seen it go as far as actually having the police involved, because it's considered child pornography once it's on your phone and you start spreading it. IWSN, which means I want sex now. A gluck, GLUCK, which means that person, male or female, is great at oral. So they also told me about some codes, and where we say educating our parents, where parent might get your phone and look at it and not actually know what that code means. So 53X is the code for sex. CU46 is the code for meet you for sex. Now, parents, if you just see the number 9, that's a signal that your child may have been looking at something, may have been sending something, and that the parent is watching. So I'm sending a 9 because I was doing something and my mom walks in. So that's to let the other person know, hey, we need to take a break, or I'll have to send you something later. Breadcrumbing, which means flirting. And the last one that it's funny that the entire group knew and they wanted to end our little discussion with was BDE, which is big penis energy. So that was really for the girls. And those were the boys, like how we said the pushing P. Well, the BDE is for the boys. Like that's the boy that you want to have sex with because it's going to be good.
Well, it seems like we need a whole nother session on all those terms. But thank you for doing that. That's really good. So Dr. Rubin, you have anything?
Wow, I thank you for that lesson, because I knew that there were a lot of terms out there, and believe me, so I think a couple of points I might just want to make are that just sort of what we've been seeing the last couple of years, because I think that that's something that we're hearing about too, is that with COVID, there was sort of this idea. We were seeing many less sexually transmitted infections being diagnosed and reported via the electronic lab reporting system, which is how we find out about cases. And so then there was the idea that people weren't having sex because of the lockdown under COVID, and our movements were more restricted. Well, obviously, we know that's not the case. People might even be having more sex because what are you going to do if you're at home all day long, right? You call your partner or whatever and whatever. So we've been seeing many less sexually transmitted infections over the last couple of years, but we know that there's an explosion that's going to be happening any minute because there's been delay in diagnosis. It's not that there's been less sexually transmitted infections, there may actually be more. And with gonorrhea, we've seen actually an increase, but with chlamydia, we were seeing a decrease in syphilis. But we know that that's because it's less symptomatic in people, or the symptoms go away and they may come back later in a more severe form. And so then we're going to begin to see that. We know that there's only sort of, as we say, the lull before the storm. And that's something that we really have to be paying attention to and really trying to mitigate, to stop that from happening. So we need to have people to come in, especially our young people, our adolescents and young adults, to come in and to be tested as part of routine. I'm also a practitioner, and I still see patients once a week. And every year we do screening on these patients. Every single year they get tested for gonorrhea, syphilis, and chlamydia every single year, just as routine screening for anybody who would be sexually active.
Thank you. Well, Toby, Kristi, do you want to chime in on this topic as well? I think it's so crucial.
Yes, I'd like to make a comment. Although it's been over, almost 4 years since I've been out of high school, and I don't do direct service as much anymore. One thing that has helped me as a provider is that when I'm talking to a young person about their sexual activity, and oftentimes, of course, at my age, they will make a statement, they will use a phrase that I am not familiar with. So there is no shame in a provider saying, tell me what you mean by that. And a lot of times the young person is very happy to educate us. And it is something that makes us public health officials better at our jobs, because that helps us understand it. It lets them see that we care about what's going on and we want to be able to help. I also want to commend Kristi for the educational piece with the young people. Back in 2017 or 2018, I was invited to come to Thornton with one of my team, and we did a presentation on STDs to a group of young people. I believe they were coming out of 8th grade and they were required to take this course before entering high school. And I have to say, I was very gratified by doing this because I honestly expected at their age, there'd be a lot of giggling and smirking and what have you. And it wasn't. The children were extremely attentive. They asked a lot of good questions. One young lady asked about transmission of HIV to a baby. So I'm very happy to see that education is still going on. And, of course, we want to emphasize how important it is. I also wanted to say it's an excellent idea to have the Parents Academy. I'm very happy to see that there are high schools that see the importance of education. My experience when my son was in high school many years ago was that the schools weren't too keen on the health department coming in and doing presentations. And I got asked to do that from the school. At that time, I was an STD, STI field investigator. But we received pushback from the administration back then. So again, I just want to commend you for making a comfortable, safe place for these young people to learn about such an important topic. So thank you.
Oh, thank you. Also, what I've found working here with the teens, a lot of the females are not comfortable with being examined. They have no knowledge about what happens when they are examined. So that's my next goal, to try to educate them on that alone, aside from the boys, because you can't know what you have without being tested. And to be tested, you have to be examined. But I don't understand, why would you not be comfortable being examined when you're okay with having intercourse? So that's been a major issue that I'm seeing here. They're like, no, I'm not letting no doctor go between my legs. So, yeah, that's the challenge that I'm finding here at the schools.
Yeah, that's another education piece. So I'm sure that there's many people who'd be happy to help you get that project going. That's really important, and goes to your whole overall total health for the rest of your life. So that's really important as well. So the next thing I'd like to talk to each one of you about is, we're talking about STIs, and Dr. Rubin, you mentioned, the increase in syphilis and chlamydia and gonorrhea. Could each one of you, and starting with Dr. Rubin, just talk about the most common ones you see and how they present? What does someone say when they come to you? Dr. Wright, you mentioned how concerned people are in the mental health aspect, which is a whole nother topic that we could dive into. But just the common STIs that are still out there, because, I always say that, 20, 30 years ago, when I was growing up, we had a lot of education focused on HIV and AIDS. And I don't even know that it's a topic discussed in the same way that it was then, because, at that time, if you got HIV or AIDS, it was a death sentence. And now with the, medications that are available, it's not the same death sentence here, but the complications of having it are still as prevalent, but just, not as focused. And I even have 2 teenagers, and I ask them how often they talk about these subjects in their schools, and it's not very often. So, Dr. Rubin, what are the most common STIs that are out there, and not just for teens? Because I know I read an article recently about an increase in syphilis among heterosexual middle-aged men.
Yeah, and in fact, there's been spread of sexually transmitted infections in retirement homes. It's sort of these small enclosed communities, and you think that when you get older, you don't have sex anymore. Well, obviously that's not true, right? So in nursing homes, there have been spread as well. But yeah, so the single largest infection that we see, the one that we see most frequently, is actually chlamydia. And most people that are diagnosed with gonorrhea also have chlamydia at the same time. And the problem with chlamydia is that often there are no symptoms. And it's it's something that's so mild that you just sort of ignore it. Maybe a little bit of a discharge. Either the male or female has a little bit of symptoms, but very minimal. But the problem is that if it goes untreated, it can basically cause, especially in the woman, and it's more diagnosed in women than men. And we don't think it's because women are more prone to getting chlamydia than men because of anatomy or whatever. It's actually because young men tend to be even less in availing themselves of medical care than young women. But also this happens in all age groups, as you were alluding to. And so in the woman who's untreated, it can cause significant problems with fallopian tube scarring, pelvic inflammatory disease, which is it's the major cause of pelvic inflammatory disease, which is basically an infection in your vagina and uterus, and it can ultimately result in scarring, and scarring in the fallopian tubes or scarring in the uterus, and it can cause sterility, or it can cause what's called ectopic pregnancies, which means that when a woman gets pregnant, that the fertilized egg won't implant in the uterus. It'll implant somewhere outside of the uterus, such as staying in that fallopian tube when it gets when the egg gets fertilized, and that can be a life-threatening condition. And then with men, it can cause strictures in their urethra, which runs through the penis, and that can also cause then sterility on that basis. So that's quite severe. Anyone can get chlamydia, as we know. And it's likely underreported in men, as I had mentioned. And we have seen, incredible rises in the cases over the last couple of years. And then in terms of gonorrhea, of course, anybody who's sexually active can get gonorrhea. And especially with like gonorrhea and syphilis and also chlamydia, you can get it from oral sex, right? You can get it from anal sex. It doesn't mean that it only requires vaginal intercourse to get it to get the infection. There are other kinds of sexually transmitted infections that we don't talk about as much. They're not as prevalent, but herpes. And there's different kinds of herpes. There's the kind of herpes that causes a cold sore, but there's another kind that causes genital herpes. But you can get genital herpes in the mouth from oral sex. So it's any orifice, so to speak, can be infected. So to go back to gonorrhea, anybody who is sexually active can get gonorrhea, but gonorrhea is more often symptomatic than chlamydia. So therefore, men are more likely to seek care when they get a gonorrheal infection because it's more likely to cause significant symptoms. And so we tend to see an more equal number of gonorrhea cases between men and women. Again, gonorrhea, you can have gonorrhea in basically any organ of the body, right? And gonorrhea, especially, it can cause, besides the urogenital kind of infection, it can cause a migratory kind of arthritis, for example, that can be quite severe, but all of this can be treated. Gonorrhea is still treated by penicillin, in many cases. And so those are the two that are most prevalent. And then syphilis, which is not as prevalent as the other two, but can be much more severe. And syphilis is also on the rise. There were about 2,200 cases of congenital syphilis diagnosed in 2020. And that's where a pregnant woman has syphilis that's untreated, and it gets transmitted to her child, and that child can be born with significant deformities and ultimately can even die from congenital syphilis if they are not treated in time. And then syphilis can, as I mentioned before, add with what we call tertiary syphilis or late latent syphilis. That's where you're not treated in the first or secondary phases, which is where you get that chancre, that sore that goes away, and then you get the rash, and that goes away. It can stay in your body for decades. And then it can reappear, and it can infect the heart and cause what's called a myocarditis. It can cause brain injury that can cause psychiatric as well as neurologic changes, and ultimately it can be fatal. So it can infect any sort of system of the body, the neurologic system, the cardiac system, urinary tract system, obviously your liver. And so syphilis, if it goes untreated and it reactivates, 20, 30 years later even, it can cause permanent damage and disability. But again, it's very easily treated if we get it early on.
Many things that I'm sure most people are unaware of. So next, Toby, did you want to expound on that as well?
Like Dr. Rubin said, many times initially you can't tell that you have chlamydia. As I've said before, with women, sometimes they have it and there's no symptoms. They don't know until they've had an examination. And with syphilis, the initial symptoms, you have them sometimes and you might not notice. Like Dr. Rubin said, there's different ways of having sex. So the initial symptom, which is a canker sore, it's a painless sore, it could be inside the body at the point of entry of the bacterium. And even if you see it, let's say a guy sees the sore on his penis or whatever, it doesn't hurt. So he's not thinking anything of it because it doesn't hurt and it goes away. And then with secondary syphilis, there can be a rash on the body or a rash on the palms of the hands or the soles of the feet that goes away as well. And that is one major issue with people not being properly treated. They see these symptoms, they might get a rash cream, and then the rash is gone, and they're like, "Oh, I'm perfectly fine." And like Dr. Rubin said, eventually the syphilis it spreads. It impacts a lot of body systems in the body. So you'll have it and you won't know. It will infect your heart. It will impact your brain. So the main point I would like to get across is that people need to get tested every year. I think it's great that with Dr. Rubin and her patients, she is normalizing getting this testing. It's just part of your annual doctor visit. You go see your doctor and get your cholesterol checked or your weight and everything else. So it's a natural course of action to also get tested for STIs if you are sexually active as a part of your health procedure and health well-being. Also, I wanted to also touch on what Dr. Rubin said about the STDs and COVID. I actually saw myself in our reporting system that sometimes the patients that had COVID also had an STI, excuse me. And also, like Dr. Rubin said, we absolutely believe this is what was going on during the lockdown. People were not going out. They couldn't go to restaurants. They couldn't go to parties. They couldn't do any of that, but they could have private company in their home. So that's it.
So yeah, thank you for that. And so Kristi and Dr. Wright, so you kind of touched on how it presents when the students come to you. So what are the most common STIs that you're seeing when they come in or that they discover they have?
I have not had that situation yet. No one has come to me with any STIs or any scares of STIs, more pregnancy scares, but thankfully no STI scares.
I've actually seen both gonorrhea and chlamydia with our young people. So in those instances, I turn it into a teachable moment. And that's when I actually decided to start a little group, got permission from the parents because we were starting to see more and more young people coming in with STIs. So what I decided to do was have a little like after school group where we sat and we talked about things that so I also brought in the mental health perspective. So what led you to have sex? And it was very interesting, some of the responses that the students shared. And then when we began to have that conversation about our health and the fact that they didn't know. So I found a great website, and this was years ago, kidshealth.org, which is still very much prevalent. And what I love about that website is that it does list the different STIs, chlamydia, gonorrhea, and you can click on it and it gives you really great information. It's like a quick knowledge base so that they begin to understand what these diseases look like. And so I would take it another step and okay, now I need you to write me a 2-page report. And they would look at me like, oh my gosh, we didn't know writing was going to be involved. But I'm like, the more that you hear about it, the more that you see it, the more that you learn about it, hopefully it will begin to stick. And hopefully you will begin to understand just how serious this is. And like Dr. Rubin said, like Toby's, like we've all said, the long-term effects. And of course, when you're 14, 15, 16, you're not thinking about long-term health effects, but it happens and it's real. And my favorite line, and they would always laugh at me, a shot can't cure everything. And so when they heard, they all cracked up laughing. And it was actually refreshing for me because that let me know that they were listening. They were paying attention. Something was starting to seep in that maybe I need to start taking my health a little bit more seriously. So kidshealth.org, and I even encourage the parents to go to that website so that they could get some information and begin to have those conversations with their children at home, because it's one thing to have that conversation at school with your counselor, your social worker, the school nurse, but it's even more important to have that conversation at home with the parents so that the kids are hearing it from multiple ends.
Thank you. That we're going to put that in the chat, that website. So thank you for that. So Dr. Rubin, with all the talk of vaccines, and now everyone is familiar with vaccines more than they probably want to be, or at least we're talking about it. So what about vaccines for STIs?
Well, the one vaccine that there are not vaccines for gonorrhea, syphilis, chlamydia, but there is a vaccine that is transmitted sexually, human papillomavirus, HPV. And that is probably the main cause of cervical cancer in women. And this is a vaccination that can be given to boys and girls age 11 and older, hopefully before they are sexually active. That's the point. I remember when I brought my 21-year-old to the pediatrician when she was just about 11, and the doctor said, well, how about an HPV? And I said, well, she's not having sex. I said, yeah, right. That's why we have to do it now. Okay. I think it's a 2-shot series. And it is incredibly important for parents to take their young men and women to the pediatrician and get a vaccination against human papillomavirus, because it will prevent cervical cancer in women when they get older, and also certain cancers in men. So,
yeah, thank you for that, and stressing the fact that it's boys and girls need that HPV vaccine. I think that's a kind of misconception out there that it's only for girls. And I learned that as well by having 2 boys, and when it was time for them to get that vaccine. So you mentioned, about getting a regular checkup, and you do offer that to your patients. What should someone do if, that kind of testing option is not offered by their practitioner?
First of all, I think that any good practitioner, any lab that they use should be able to do that, and that practitioner should be educated to offer it. But otherwise, if people just want testing, the city of Chicago has a couple of clinics for sexually transmitted infections where you can go on in and you can get tested. You can go to any of the Cook County health facilities. You can go to the federally qualified health centers, and you can go into these places and they will do testing for you. This is something that we work very hard within the Cook County health system in particular, to work with all of our community-based clinics, what we call our ambulatory care centers, to allow walk-ins for people who want to be tested for STIs, whether they have been exposed, and that's the usual reason, that they've been exposed to somebody who has been diagnosed with an STI, or even those that are just concerned about it, or people that want to have a yearly screening to go in because they're concerned, they're sexually active, they want to be safe. And they can go into these clinics and can ask for a test.
Does anyone else want to offer any testing options or advice if someone thinks they should be tested?
I think as we discussed the annual doctor's visits, I think that women and men as well, even if there are no symptoms, still get tested for STIs, because as we've discussed, sometimes you won't know that you have anything.
Great point.
And I think that it's really important for parents, if you know that your child is sexually active, to have them tested. A lot of things can be prevented. And so parents need to be comfortable enough to have those conversations. And it's not an easy conversation to have with your child, but it's very much a crucial one to have with them, from the mental health perspective, from the physical health perspective, and to just ask, hey, Is there anything going on? And not wait until it's too late, because you don't want to be caught with, after the fact, knowing that your child has been having sex and there may have been something that you could have done to prevent it, simply by taking them to get whatever vaccinations are available, or just having that education readily available for them.
And Dr. Wright, I admire that you are normalizing having conversations amongst the young people and their parents. When my son was in high school, I had him do a paper on syphilis, because I mentioned earlier that I did it myself when I was in 8th grade because it was an interesting topic to me. But it was something that stuck with him as far as making it normal to have these conversations about sex and about STIs. My son is almost 34 years old now. And, he said that, amongst his friends, they talk about it, or they'll make jokes with Daniel saying, oh yeah, your mom is the STD lady. So I commend you for making sure that the young people are being very comfortable talking about this topic, because as they get older and they start having children of their own, they will see the benefit in talking to their own children.
Yes. Thank you. And I even go as far as showing them pictures, letting them see what, and Kristi's shaking her head like it, letting them see what genital warts looks like, letting them see, like the microscopic views of what these STI looks like. And they are completely astonished. Like, oh my God, I didn't know that's what it looked like up close. Yes.
That is an excellent teaching tool. When I used to work in clinic, we had photos. I still have those photos to this day. They're in my syphilis library. I use those in clinic to show patients, this is what a canker looks like. This is what the syphilis rash looks like. So a visual tool is very effective, in my opinion, very effective, mostly effective with young people.
Yes.
Excellent points. And once again, communication on every level is the key, whether it's from, a practitioner to a student, or even an adult, not just student, and parents to their child. And, unfortunately, a lot of the kids get their information from the internet or from each other, which may be incorrect information. So it's good to be able to correct that conversation. So in the last couple minutes, before we wrap up, I would just love for each of you to just go around and say, what advice would you give if someone needed more information or needed testing, or if they're a parent, or even, like you said, Dr. Rubin, in nursing homes, some STIs are running rampant. How do we, and I love what you're saying too, Toby, about normalizing the conversation. What advice can each of you provide as to how we normalize this? Especially, I've seen medication, as I've mentioned, changed over the last few decades so that they're really good. I mean, so we have great therapies, but that doesn't mean we should be careless and, still, be okay with, getting an STI because they're preventable on the other side, not just from getting medication intervention afterwards. So Dr. Rubin, you want to start on that topic for us?
Yeah, I think that, from the health department's point of view, what we really need is the partnerships in the communities, like you guys on the call today, who are working in the communities, working in the schools, to touch the young people, right? Because that's how they're going to get the information. Is we need to have better and uniformly comprehensive sex education in schools, starting in elementary schools, not just in high schools. And it needs, as I said, to be comprehensive, not just said, this is your health class and wash your hands after you have sex, and that's all we're going to tell you, or something like that, right? It needs to be comprehensive. It needs to be at the level where you can engage young people so they can feel comfortable having their questions answered. I think that we also need, we have lots of resources on our website for older folks or those that don't get their information just from TikTok, but we need to be engaging more in social media and using the platforms that young people use. and also the more middle-aged and older people like me, where we go on Facebook, right? To use those platforms as well, and to explain that this is not just a problem of the young who are being irresponsible, and to say that's not the problem. The problem is that people don't understand and don't know what these diseases are and what these infections can cause. And we need to use, I think, so basically our community partnerships, uh, uh, utilizing more and more effective ways, social media, and also just the standard other kinds of educational ways that we reach out, by giving talks, by having these kinds of forums, and being out there in the community, having and offering available, free, accessible testing and treatment, obviously.
Thank you. Toby?
I agree with everything that Dr. Rubin has stated. And I'd like to say that prior to COVID, my team would go out by request to nursing homes, schools, to have this information, to have presentations about STDs. I once went to a place just to drop off condoms, and I wound up getting pulled into a parental town hall meeting. They found out I was from the health department, and they decided to immediately use that resource. So I had to go in and just present off the top of my head. So I think free information, I agree with the website, of course, our Cook County Health Department website, to get that information. Something else I wanted to point out about treatment. Yes, treatment, will cure chlamydia and gonorrhea, for example. But like Dr. Rubin said, there can be some scarring from the STI. The treatment will not solve the scarring. So you can get treated, but if you continue to get STI, you can continue to have worse symptoms, and then you will wind up having the scar tissue that will have to be surgically removed. So I want to point that out, that in my experience with patients that would come to clinic, they would often say, especially if there's someone that had seen me before a few times, they would say, all I have to do is come here and get treatment. Yes, you can get treatment, but later there's going to be scar tissue up there that the doctor is going to have to remove in a very uncomfortable manner. So they have to remember that you can be treated for STDs, but sometimes there are long-term effects that are not so easily treated.
I'm a big proponent of talking, obviously, as a therapist, but really for the young people, feeling comfortable having those conversations with their parents, and for the parents feeling comfortable having those conversations with their children, but more so asking the why. Many times I was asked, well, what is your role here as the mental health school counselor? What is your role as the therapist? And I would always say, I'm the why person. Why did we get to this point? How did it get this bad? So a lot, and many times there are deeper issues as to why these young people are having unprotected sex, why they feel like they are just, inevitable. And when you really begin to go deep and have deep conversations with these young people, you really understand that they're trying to mask something else. They're trying to fit in. They're trying to be someone that they truly are not. So parents, please ask those why questions. Why are you doing this? And for, like Toby said, our young men and women who have it multiple times. Well, what's going on that you didn't, you missed something the first time. You knew what the effects were. You knew what the symptoms were. You knew the treatment. You didn't like it. So why did you do it again? And just going deeper and deeper and finding out what is the root of the issue.
I agree with you. Lots of education. Like I said before, a lot of my students are not comfortable talking to their parents. So I'm their person. And if I can't answer their questions or make them feel comfortable to at least talk to me, I try to convince them to at least talk to their parents, because this is a really, really serious issue with the teens. I try to get them to ask me questions. I'll ask you questions, but ask me whatever it is you think you want to ask me, anything that floats off the top of your head. So there was a situation where I had to ask a student, would you like for me to talk to your mom for you, or do you want me to be present? I mean, whatever I can do to help get through the kids is what I like to do, so they can understand how serious it is. Because it's not just about being pregnant, it's STIs. It's STIs. That's the major issue.
Exactly. Well, this was a wealth of information. Thank you all so much for sharing your time with us today. And we will put all of your contact information in the chat for anyone who's listening and wants to share this presentation anywhere. We hope you will share it far and wide, because it was a wealth of information. And I know we could have gone on for at least another hour on a multitude of topics. But thank you all, Dr. Rubin, Dr. Wright, Kristi, Toby. Thank you so much for the work that you do, because I think that just knowing that you're there is comforting, to know that there's healthcare experts out there for people to talk to and have the availability to ask those questions, to get resources, to see a physician, get tested. All of that is so important. So thank you all so much for being here. And as I mentioned earlier, this is going to be recorded, so you can view this presentation later if you missed any parts of it. We thank everyone who joined us today for this STI Awareness Town Hall, and we look forward to seeing you again.